Good evening, my name is Yusuf BAHNIAR PUTERA with name 20095111108. This video is made as my assignment for uh, premedication anesthesia by Dr. Hewan Igusti Ngurah Sudisma MSI. The task was to make a video on premedication anesthesia. Premedication is using medication before some other therapy, usually surgery or chemotherapy, to prepare for that forthcoming therapy. Typical examples include premedicating with a sedative or analgesic before surgery. Analgesic drugs, if you don't know, are given preemptively to reduce the required dose of anesthetic agent and improve patient comfort and in the immediate postoperative period. The options for analgesic medicine are usually opioids, paracetamol, non-steroidal anti-inflammatory drugs or NSAIDs, or gabapentin. The other premedication are also often used as prophylactic or preventative antibiotic before surgery, also using antiemetics or antihistamines before chemotherapy. A few other reasons for giving a premedication are to reduce anxiety and pain for the patient, promotion of amnesia, to increase the effect of the amnesia drug, to reduce some secretion, for example, for hormones or bloods and such, also to reduce the volume and pH of gastric content, usually to avoid Mendelssohn syndrome. Can be also given to reduce postoperative nausea and vomiting, can be used to enhance hypnotic effects of general anesthesia, reduce vagal reflex, and other specific indications such as prevention of infective endocarditis with antibiotic. Now the other task is to talk about anesthesia. Anesthesia is also a sort of medication given before a therapy, usually for surgery. So what's the difference between anesthesia and medication? Well, from what I read and from what the doctor have given us, I believe anesthesia is one of the many parts of premedication. It is after all a drug given before a surgery to help with the surgery. So what is anesthesia? Anesthesia is a state of controlled temporary loss of sensation or awareness that is induced for medical and veterinary purpose. It may include some or all of analgesia for relief or from prevention of pain. It can induce paralysis or muscle relaxation. It can induce amnesia or loss of memory, and mainly, usually for us veterinary, to induce unconsciousness. An animal under the effect of anesthetic drug is referred to as being anesthetized. Anesthesia enables the painless performance of procedures that would otherwise cause severe or intolerable pain to an animal that is not anesthetized, or would otherwise be technically be unfeasible. Three broad categories of anesthesia are the general anesthesia, sedation, and regional or local anesthesia. General anesthesia suppresses central nervous system activity and results in unconsciousness and total lack of sensation. It's usually given as an injection or an inhaled drug. Sedation also suppresses central nervous system, but to a lesser degree, inhibiting both anxiety and creation of long-term memories without resulting in unconsciousness. And then regional or local anesthesia blocks transmission of nerve impulse from specific part of the body. Depending on the situation, this may be used on its own or also can be used in combination with general anesthesia or sedation. These drugs can be targeted at peripheral nerves to anesthetize an isolated part of the body only, such as numbing a tooth for dental work or using a nerve block to inhibit sensation in the entire limb. Alternatively, epidural and spinal anesthesia can be performed in the region of the central nervous system itself, suppressing all incoming sensation from nerves supplying the area of the block. In preparing for a medical or veterinary procedure, the clinician can choose one or more drugs to achieve the type and degree of anesthesia characteristic appropriate and needed for the type of procedure and the particular individual. The type of drugs used include general anesthetic, local anesthetic, hypnotic, dissociative, sedative, adjuncts, neuromuscular blocking drugs, narcotic, and analgesics. And that is all of the videos on premedication anesthesia. Thank you, and if there is any mistake, I hope Dr. Agustinus Sudisma can give me some correction and some headings on what am I supposed to do in this video, because honestly there is none. Thank you.